Good afternoon, and thanks for being here again. I'm Dr. Martha Buchanan, the Health Officer and Director here at the Knox County Health Department. In honor of National American Sign Language Day, we want to dedicate our moment of gratitude to our sign language interpreter, Dawn, and her colleagues at the Center of the Deaf, the Knoxville Center of the Deaf. They've been an amazing resource for our community by interpreting our media briefings. For that, we are extremely grateful. I also want to thank my staff of epidemiologists and team members who are 7 days a week doing contact tracing, monitoring, and case investigations. So what does that mean to you? What that means is if you are diagnosed with COVID-19, somebody on my staff is going to reach out to you. We're going to ask you a whole lot of questions about where you've been and what you've been doing and who you've been around. So then we can reach out to those people that you've been around the most, called your close contacts, and talk to them and educate them about their risk. It's important to understand that we use a risk assessment. It's a risk assessment basis to decide who we reach out to. And what that means is we reach out to the people who have been around the confirmed case most often and the most time. Those are the people that are highest at risk of getting COVID-19 from that person. So what we ask those close contacts to do is stay home for at least 14 days. So we're further reducing risk for the community so that the case is in isolation. They're staying home until it's safe for them to leave. Their close contacts are in isolation. They're staying home for a given amount of time until we can see if they get sick. And that reduces the risk to the community. So we're doing all of these things, but those are not substitutes for everybody observing the stay-at-home order, social distancing, washing your hands, staying home if you're sick, and doing all the things that we're asking you to do. We're asking you to stay home most of the time. And we know that's a challenge, but we know it's working. We know it's helping. Evidence and time tells us that. Let's see. Oh, I think the other thing that's important to note, because of the stay-at-home order, we're only having about 4 or 5 close contacts for each of our confirmed cases. And that is a low number. You can imagine when we eventually open things back up, we'll see that number go back up. But that does help us kind of tell that people are really following the stay-at-home order, and we really appreciate that because we know it's protecting you and it's also protecting our community. So on to our, one more thing about contagiousness, sorry. So one of the challenging things about COVID-19 is that people with and without symptoms can transmit COVID-19 to others. We know that people who are the most sick, people with fever, people with cough, those people are going to do what we call shed more virus. In other words, they can make more people sick. People who don't have symptoms can also make people sick, but not as easily. So again, go back to, that's why it's really important to wash your hands, follow the stay-home order, and minimize your contact with others to reduce your risk, but also reduce their risk. And also, we're encouraging folks to wear masks when they're in public. I know there are lots of groups out there that are making masks and making masks available to people. So wearing a cloth mask in public helps protect others and gives you a level of protection as well. So now on to the numbers. We currently have 172 confirmed cases of COVID-19 in Knox County. Good news, 136 of those have recovered. That means they're out of isolation and or they're out of the hospital, all of those things. 21 individuals have been hospitalized at some point in their illness. And we gratefully can announce that we have not had any more deaths from COVID-19. We have received some questions regarding the heat map that's available on our website. This map is designed to provide a general view of cases by zip code across the county. It is not designed to help you determine risk. It's not what it's for. It's just really general information. Regardless of where you live, we are all susceptible to COVID-19. And when we moved from travel-related cases to community transmission, that just means it's in our community. And like I said before, sick people and non-sick people can transmit this illness. So we're all at risk. There's no evidence to support that any one place is riskier than the other place in our county. So the broken record that I am, I'm going to go back and say that's why it's important to follow the stay home order and be diligent about hand hygiene and wearing a mask when you're in public. We really do understand people want to know about risk, but I think it's just important to understand that we all can potentially get this illness, and we all have to do our part to protect not just ourselves and our family, but our entire community. And we really appreciate everybody doing that, even though we know it's hard to do. So with that, I'll open it up for questions.
All right, if anyone has any questions, please go ahead and submit them now. From WBIR, I have a few questions about masks at stores. Should workers, cashiers, etc., be required to wear them? And can the health department require that?
Under current CDC guidance, wearing a mask in public is simply a recommendation. We'll continue to follow that guidance from the CDC.
Their follow-up question to that was, can the health department require customers to use masks at stores? Should customers be wearing masks?
Goes back to the previous answer. The current recommendation is for people to wear masks when they go in public, when they can't observe social distancing guidelines, and to continue to wash their hands and keep areas clean. I've really been impressed with the level of conscientiousness I see in the grocery stores and places where I have to go to get my groceries. They're cleaning areas frequently, those high touch areas, and that's really important in reducing the risk for this disease.
From the Compass, what is the most important metric you will use to make recommendations to Mayor Jacobs? Total cases, active cases, onset of symptoms, and why is it the most important metric?
What we'll look at as the team convenes, we will be looking at total cases and active cases. And that's the most important metric because it tells us the burden of disease, or how many people are sick in our community. I think the other really important thing that's going to be necessary for us to really see the level of disease in our community is increased testing. And two things have to happen for increased testing to happen. Providers who aren't testing need to start testing. Well, three things. Providers who are not testing need to start testing. We need to have enough supplies to obtain the specimen. Those are the little swabs and the transport things to send them to the lab. And the labs need to have increased capacity. Knowing the burden of disease is going to be really important in helping us understand as we open, in recommending that we open, and then as we open, do we need to back off? Did we go too fast? We're going to have to really be able to see that, and that's going to be really important to be in place to safely open up our community back to a more normal operation.
From the Sentinel, how many cases of COVID-19 have been diagnosed by doctors without being confirmed by a test? Are they required to report those diagnoses to you or to state or federal officials?
So the only way to be diagnosed with COVID-19 is to have a laboratory test to confirm that you have the disease. So there are no cases being reported that aren't laboratory confirmed. And they made COVID-19 one of our reportable diseases. So under that law, laboratories are required to report positive results to the State Department of Health, and that is happening regularly. Some physicians also will call and let us know, and we're grateful for that, but it really is through a laboratory reporting system. That actually is how we get information on all reportable diseases year-round. COVID-19, the volume's just a lot higher, but we're using the same reporting mechanism.
In addendum to that question, if you want to expand, they ask, is there any official count kept anywhere by any public official of diagnosed but untested COVID-19 cases?
Again, you can only be diagnosed with COVID-19 if you get tested for it, and it's a laboratory confirmed test. Sometimes we do have what we call probable cases, and those cases are ones who have contact to a known case and are sick. And we don't have that case definition from the State Department of Health yet. It's a process to get that vetted through the CDC and the State Department of Health. But right now, the only way to be counted as a case of COVID-19 is to have a laboratory confirmed diagnosis. So there are no non-laboratory confirmed cases.
From WATE, do you support Mayor Jacobs's proposal to gradually reopen the county in 6 weeks? And were you consulted throughout the planning process?
So just a little bit about the plan. You know, planning is happening at every level of our nation, state, city, county. And Governor Lee made an ask from Mayor Jacobs and lots of other county mayors and city mayors to send up recommendations on how to reopen the state. And so that's what Mayor Jacobs did. I support a phased reopening. The plan is thoughtful, and we will use it. As we said before, we're convening a local team to start local planning. This was for state level planning. We'll need a local plan. As you know, across our state, Nashville and Memphis look way different than the rest of us do. So planning to reopen in those areas are going to be very different. So I'm appreciative of the partnership with the city and the county to start locally planning. We're also bringing the chamber into that conversation. We'll look at the data, make some recommendations, look at Mayor Jacobs' plan more carefully, which again is a phased plan. We'll use it as our basis as we move forward.
From WVLT, grocery stores are an essential business. Does the health department have an opinion on the use of grocery bags brought from home? Are they a greater risk of carrying the virus than plastic bags supplied by the stores?
You know, grocery stores have made independent decisions based on their assessment of risk for people using grocery bags bought from home. I certainly can understand that concern. So the more important message is to remember to wash your hands before and after you go to the grocery store, and to have that hand sanitizer available for employees. You know, the more things in and out of the grocery store, the more risk there are, mostly not to patrons so much, but to the employees that we need to still be working and not being sick. So I think anything they can do to reduce risk to their employees is vitally important, and keeping that necessary and essential service available to all of us.
From the Sentinel, do you or Knox County hospitals or the state have the number or an estimate of total active COVID-19 cases in Knox County, including those that have been untested and will never be tested?
So the only answer I can give is that the only way to be a confirmed case of COVID-19 is to have a laboratory confirmation test. There are no non-lab confirmed cases being reported or tracked. You can't be a case of COVID-19 if you haven't been tested with an FDA approved test through an approved laboratory and have that diagnosis based on that laboratory test.
From WBIR, it has become clear that Mayor Jacobs is eager to restart the economy and lift stay-at-home orders. If he asks you to do so before you feel it is safe, what will you do?
We're all ready to reopen the economy. All of us. We want to all do that safely, and we're going to do that together. And, you know, Mayor Jacobs and I have conversations about this, and we will provide advice, and we'll have to wait. Some of it we'll have to wait and see what the governor says. There are a lot of factors at play there. We'll make that decision together as a community and as leaders.
From WATE, we've seen an increase of 26 cases in 1 week. Could you say what this says about our projected peak locally?
You know, looking at just 1 week of data really doesn't help us project out very far in the future. We need we need a lot more data than that. What we can say is that not unexpectedly, our case rate is slowly increasing each day. Our case numbers, we're not surprised by that. We're not speeding forward. What we've also seen is over time, what we call our doubling rate has actually gone up. So that means it takes longer to get twice as many cases. That's a good thing. That tells us social distancing is working, and that we're beginning to do that, flattening the curve, slowing down the slope, so we're not going up so fast.
From WBIR, you say you started Monday expanding testing capacity at KCHD to 90 from 15 to 20 a day. Are you reaching that capacity every day? Are you indeed administering 90 tests a day? And if not, why not?
So we haven't yet. It's only Wednesday. We just started on Monday. So some of it was just the beginning day, Monday, kind of working out some of the kinks in the process. We encourage people, if they're concerned, if they feel like they need to be tested, to call our 215-555-5555 number. They'll be asked some questions about symptoms, about their chronic illnesses, whether they work in healthcare, and then offered opportunities for testing if appropriate. No, to my knowledge, no one who qualifies for testing has been turned away. So we're really happy about that. We want to maximize that capacity. We have the capacity to test around 90 people each day during the week at that facility in either a drive-through fashion or even a walk-up fashion, if that's what works for the person.
From the Sentinel, they say this last one is from one of their other follow-up questions. Are there deaths that medical experts are attributing or can attribute to COVID-19 or complications from COVID-19 that have not been included in the official count because the person was never tested?
That's a great question. And I think it's entirely possible, just like flu deaths and other deaths that are that don't get attributed to the underlying disease. Most people who die from COVID-19 die from complications of COVID-19, such as pneumonia or other complications that they might get. So some of those who might have had COVID-19 possibly have died and not been diagnosed. We do know that our medical examiner is following the guidance from the state medical examiner on who, after death, testing folks that are seem appropriate for testing to help with that data.
From WATE, do you see a scenario where things return back to normal without a fully approved vaccine available?
Yeah, we will have to have things back to normal before vaccines available. An approved vaccine is months, if not a year away. That process takes a really long time. I know you heard the news that two or three different companies are trying to develop a vaccine more quickly, but the truth is that process takes a while and we won't have a vaccine available for a while. And so we need to continue our social distancing. And we probably need to continue social distancing quite a while. That doesn't mean we can keep everything closed down. Social distancing is that, reducing the distance and reducing contact. Our guidance for reducing infection hasn't changed. It's changed, but it's always been washing your hands and staying home if you're sick and reducing contact with people who are sick. People are going to still need to do that. Long after we've reopened the economy, people are going to still need to do those things. And we're still going to be encouraging people to do that, not just around COVID-19, but around the flu, around GI illnesses and everything else that we can pass back and forth between each other.
From WBIR, a University of Washington study says the peak for Tennessee is expected in the next 48 hours. The Vanderbilt model projects a peak in mid-June. What is your expectation and what model numbers are you using?
We're looking at multiple models along with our partners in healthcare and in government. And a model is just that. A model is just a predictive model. It's kind of like a weather forecast, giving us an idea of what it might look like based on the current situation or based on what we've seen in the past. Models change based on changes on the ground. So I think we're going to have to wait and see. We won't know when we've peaked until we start seeing a trend coming back down. And again, models are just models for predicting, and they're not absolutes. I don't think we have a great idea of exactly when we will peak here in Knox County.
From the Compass, how does the health department determine when a person leaves isolation and can be put into the recovered category?
So currently the guidance from the CDC and the Tennessee Department of Health, a person has to be either 7 days out from their onset of symptoms and have 72 hours with no symptoms, or it could be longer. So if they're symptomatic up until day 8, they've got to go 72 hours without symptoms. So that pushes them out to 11 days. So we're monitoring those folks. We're contacting those folks every day to see how they feel, marking that time and letting them know when they can be released from isolation and they get added to the recovered list.
From WBIR, on the medical examiner point you made earlier, do you know if any tests have been taken post-mortem and have there been any positive tests from that scenario?
I don't know, and that's a great question for the medical examiner's office.
If there are any other questions, please go ahead and submit them. From WBIR, what was the end testing result, if you know, of the drive-through testing you did at Chilhowie a couple weeks ago, positives versus negatives?
Honestly, I don't have that information. We partnered with Kroger to do that, so they were the provider that day, so they got the results back, and we only get the positives.
They've also asked, is it correct that you did not max out on the number of people you could accommodate those 2 days?
We came really close. I think our goal was 150 each day, and we came in just a little bit under that. We don't have any answers as to why that happened, but we know we came in a little under that.
Any other questions? Please go ahead and submit them now. All right. Well, thank you, everybody. We appreciate it. And we will see you Friday at 12:30.